Typically, this presentation happens when patients have some uncontrolled hypertension, like symptoms such as very high blood pressure or very high blood sugar diabetes that's hard to control. Also, patients that gain weight in a short period of time. We all can gain weight gradually over the years, but when someone gains a significant amount of weight in a short period of time, also when we see patients with excessive bruising of their body, or the body fat distribution is in a certain areas where it's more pronounced, central or abdominal area, and the back here, and they have muscle wasting of the upper and lower extremities, abnormalities in potassium. So basically, all of those clinical scenarios can sometimes alert our primary doctors that maybe something is going on with the adrenal glands, and then they can send the referrals to us. In general, as we mentioned, the adrenal gland is responsible for multiple hormones. So basically, if there is overproduction of every one of these hormones, then the presentation will be different. So the overproduction of the cortisol, which what we call it Cushing's, is a very bad disease. It causes, again, it can, most of the time, it is more of a slow process, but in some cases, we see very bad deterioration. So Cushing's, when there is excess cortisol, then there is the constellation of the findings that we mentioned, which is excessive weight gain in a short period of time, diabetes, hypertension, low potassium, body fat distribution in certain areas, along with the muscle wasting of the upper and lower extremities. Now, there is also, as we previously in our first meeting, we talked about that the problem can be starting in the adrenal gland, or it can be starting in the pituitary gland. So the first thing is to see, again, is there clinical features suggestive of high cortisol? And the next step is to establish if the problem is starting in the pituitary or the adrenal, which again, that ACTH level will help us to differentiate. And then the next step is to proceed with imaging. So it has to be clinical diagnosis, biochemical diagnosis first, and then proceed to imaging. So the biochemical diagnosis means that we have to have evidence that there is actually high cortisol, because a lot of the symptoms that we described, they can be also confused with obesity, like patients obesity lead to metabolic syndrome. So there is some overlap with obesity, but when the features are excessive and we're having multiple of those